Flu is a generally mild disease with a very good outcome. But if you're in at-risk groups, or indeed if you're pregnant, we now have very good evidence that it's a much more serious disease and can be occasionally fatal. So if we just take a worst case scenario, in 2009 15 women acquired influenza infection and died, and of these 15, 9 of them didn't have any risk factors, so we wouldn't have been able to identify them. They didn't have lung disease, heart disease, kidney, liver disease, neurological disease, diabetes, immunosuppressed. Didn't have any of these. They were, to all intents and purposes, normal, and yet they got flu and died. And it's an absolutely dreadful outcome to think that 15 women developed flu 2 years ago, 3 years ago, and died because of an infection that we can prevent with vaccination. Flu vaccine is a dead vaccine, just made up of bits of the virus. In young people, the efficacy of the vaccine is high, and what you would expect is that within a few days of being given the vaccine, mum will be developing antibodies that will protect her, and it should protect her against developing serious disease. What about the benefits to the baby? Well, or to the developing baby? Well, again, what we know is that the antibodies that mum produces will circulate in her bloodstream, will cross the placenta, and will get into the baby, and will provide protection for the baby, both within the womb and also for several months after delivery. So you've got twofold benefit: one to the mother herself, stops her getting serious disease, and also to the baby, it protects the baby for several months after birth. What about the benefits? What about the vaccinations? Any adverse events? There was a very nice study done in Canada which looked at 55,000 single childbirths, and what that demonstrated very conclusively was no adverse outcomes for either mother or child in terms of vaccine side effects. And that I think is very powerful evidence that a pregnant mother can take on board to show that what she's doing is the right thing both for her and her baby.